Good afternoon, and thank you for joining us for today's webinar, Called to Action, NORD's Response to COVID-19. For over 30 years, the National Organization for Rare Disorders has focused on the health and well-being of people living with rare diseases and their loved ones. We want you to know that during the COVID-19 pandemic, our commitment to serving you is stronger than ever. My name is Katie Kowalski. I work in the Education Department at NORD, and it's my pleasure to be your host for today's webinar. The purpose of today's webinar is to share information about services and educational resources intended to support the rare community during the COVID-19 pandemic. We will also provide updates on COVID-related advocacy and policy initiatives. Today's webinar is part of NORD's COVID-19 education series. This series is being brought to you with support from Biogen, Horizon Therapeutics, Sanofi Genzyme, and Strongbridge Biopharma. And now I'd like to introduce our speakers. Today I've asked my colleagues at NORD to share recent updates with our webinar audience. Vanessa Boulanger is the Director of Research at the National Organization for Rare Disorders. In this role, she leads the strategic development, growth, and implementation of NORD's scientific and research activities. Vanessa brings over 15 years of experience addressing health and social inequities from a broad range of perspectives to her role at NORD. Jill Pollender is the Director of Patient Services at NORD. As a registered nurse, Jill has over 30 years of diverse professional healthcare experience, from the emergency department to long-term care, to a specialty in pain management and palliative care. Jill is a fierce advocate for patients and their access to appropriate care and treatment. And Rachel Scher is the Vice President of Policy and Regulatory Affairs at the National Organization for Rare Disorders. Rachel has nearly 20 years of experience in health policy, having served in the Commissioner's Office at the Food and Drug Administration, and worked on Capitol Hill for 10 years on many federal health care issues impacting rare diseases. Rachel leads NORD's strategy for engaging with the federal and state legislatures and regulatory agencies to effect positive change for the rare disease community. And with that, I will ask Vanessa to get us started.
Thank you, Katie. Hi, everyone, and thank you for joining us today. I'm so pleased to introduce some of the work that NORD has been doing to support the rare disease community during this challenging time, with all of the disruptions and obstacles we are newly navigating during the COVID-19 pandemic. I oversee NORD's research initiatives, and so I will talk a bit about how we are continuing to support the community through online data collection, both through our I Am Rare Registry and Natural History Study program, and in particular through the development of community surveys that allow us to hear directly from you on the most needed resources. The information that you have shared with us helps to shape NORD's response as we continue to address the evolving situation and provide information, education, advocacy, support, and services to the rare disease community. So NORD put together a short survey to assess the impact of the coronavirus, COVID-19, on rare disease patients and their families in the United States. We wanted to hear from the community directly and to understand the nature and extent of the issues experienced during this time. The survey was promoted through NORD's website and social media channels and was open to the public community for 1 week earlier this month in April. An in-depth report of the survey results will be available in the coming days, and today I will just share some of the initial findings and themes from the survey. So we had 772 people that responded to the survey. 2/3 of survey participants had a rare disease themselves versus responding as a caregiver or a family member. And 3/4 of survey participants were over the age of 40. It was clear from the survey results that the community is overwhelmingly concerned and impacted by COVID-19. 98% of survey participants indicated that they are worried, and of those, 67% are very or extremely worried. In addition, 95% of survey participants indicated that they have been impacted to some degree. The sources of concern and worry were varied, though a number of people raised concerns about safely accessing healthcare if or when needed, feeling unsure and worried about the timing of seeking care, not seeking care too early or waiting too long, for example, medications being out of stock or back ordered, and concern about risk of exposure while immune compromised. So here we can start to see the significant impact on access to care and how technology is being leveraged to re-envision how healthcare services are provided while also maintaining support for social distancing measures. 39% of survey participants have experienced challenges related to accessing medical care or treatment. 74% have had a medical appointment canceled due to COVID-19. And of those, 59% have been offered an alternative appointment with their provider, either via telephone or video. And finally, here we see the financial impact and the economic instability felt by the community. So 29% of survey participants indicated that their employment status had changed, either temporarily or permanently due to COVID-19. 40% have experienced a loss of income at the household level. And in terms of insurance, nearly half of the participants who had a change in employment status also lost their health insurance. This is clearly an evolving situation that is having significant immediate impact and projected long-term impact on the rare disease community. As I mentioned at the start, a report of more in-depth findings from this initial survey will be available in the coming days. And a big thank you to those who participated. This survey was the first in a series that NORD will run so that we can continue to monitor the experiences and impact that our community is facing, and to make sure that NORD is responding and providing resources to address your biggest concerns. So on that, I'm so pleased to introduce my colleague and the next speaker, Jill Pollender, NORD's Director of Patient Services. Thank you.
Thank you, Vanessa. Good afternoon, everyone. Thank you for providing me the opportunity to share some of what NORD's RareCare Patient Services team is doing to support the rare disease community. As a registered nurse with both the privilege and responsibility for leading this team, I understand just how critical the need uninterrupted support is. I understand the importance of organizing and responding to a crisis in a manner that ensures that access to care and treatment is maintained. My team and I appreciate the trust that you have in us. We have seamlessly transitioned to working remotely to ensure that we are and remain able to assist you. So how is the patient services team supporting the rare disease community? We're here answering your calls and emails, and there are a lot of them. Patient and information and resource services answer an average of 1,736 calls a week, and we process an average of 1,148 emails per week. We answer questions, lots and lots of questions, some related to coronavirus and living through this pandemic, and others more typical of day-to-day living rare. We answer calls related to NORD's programs and help to find resources when needed. We are not providers of care, but we can help maneuver through this obstacle course. Our communication center hours remain unchanged, Monday through Thursday, 8:30 a.m. to 7 o'clock p.m. Eastern Time, and on Friday, 8:30 a.m. to 6 o'clock p.m. And here's part of NORD's RareCare Patient Services team. This is us celebrating Rare Disease Day and our commitment to the rare disease community. These are the folks answering those calls and emails, answering your questions, and assisting with navigating the challenges. NORD's programs and services have for over 37 years assisted our rare disease community to overcome barriers and to facilitate access to care. This goal remains unchanged, even in these greatly changed times we're living in. NORD's 80 disease state-specific patient assistance programs provide assistance with things like premiums, co-payments, and other out-of-pocket costs associated with the care of a rare disease. We continue to provide this assistance now and are currently assisting over 6,000 individuals and families. That number rises daily. In response to the COVID-19 health crisis, we are committed to providing the kind of immediate help that many of our community members so desperately need. The NORD COVID-19 Rare Disease Assistance Program opened on April 15th, enabling us to provide support to rare disease community members whose lives have been impacted by the current pandemic. The COVID-19 Rare Disease Critical Needs Non-Medical Assistance Fund provides rare disease patients with financial assistance that may be utilized to support critical, non-medical needs due to the COVID pandemic. The program provides financial assistance for essential expenses, things like unexpected utility expenses, communication expenses like phone, cell phone, or internet, emergency repairs to car, furnace, home, or major appliances, assistance with travel and lodging, logistics and expenses, rent or mortgage payment assistance, and support for adaptive learning during school closures. Assistance is based on eligibility and funding availability. Review criteria includes confirmation of a rare disease diagnosis, evidence that the need is driven by the COVID-19 pandemic, confirmation that the assistance being requested is consistent with the non-medical program criteria, and financial eligibility. Individuals seeking assistance from this fund can contact NORD via dedicated phone or email address. So what are the top needs that my team is hearing about during this crisis? Vanessa spoke a bit about the concerns and needs reported for the NORD survey, and these reflect just what we hear every day as we interact with the rare disease community. We're asked about information and resources, particularly about premium assistance and avoiding COBRA costs. We're asked about access to telehealth services and continued access to infusion sites. Educational support services for children who are now being homeschooled. We're asked to decipher the plethora of information circulating. And of course, we're asked how NORD can assist. We are here as always. Reach out to NORD, our information and resource services. Now, as always, we strive to identify additional needs of the rare community and to lessen the burden. There are a lot of websites, links, and webinars out there. Please be a critical reader and reviewer of content. There's a lot of stuff out there. For reliable, user-friendly, all-in-one-place information, the NORD COVID-19 landing page provides current, reliable, and reputable content in a single stop. In a moment, Rachel Scher, NORD's Vice President of Regulatory and Government Affairs, will share NORD's actions and initiatives important to the rare disease community and how you may become involved. I thank you for your time and for joining this webinar. Be well and stay safe. Rachel?
Thanks, Jill, and thank you everyone for joining the webinar today and for giving us here in the Policy Department an opportunity to speak with you. I wanted to today take a few minutes to talk through all of the resources and information that you'll find on NORD's COVID-19 policy and website, and to explain more in depth a little bit of the work that we've been doing, as well as talk about some of the ways that you can get involved. First of all, on the rare disease website, which the website will be listed at the bottom of each of these slides here, I want to show you how to find out about what the NORD policy team has been doing with respect to COVID-19 policy. As you can see on this link here, there's a drop-down that says NORD COVID-19 policy statements. All of the work we do is posted in real time on our website here. And as you'll see, if you go to our website and scroll through this, the policy team has been extremely active since the beginning of the coronavirus crisis. I just want to flag a couple of highlights in terms of policy areas that we've been working on here. For the rare disease community, social distancing has had some particularly challenging effects. Access to ongoing medical treatment for patients who have been told to stay home has been a major concern, and NORD took swift action to try to help in a few different ways. First of all, many states had licensure requirements that were preventing patients from seeing their out-of-state providers by telemedicine. So NORD sent letters to 20 different governors asking them to adjust these licensure requirements. As a result, to date, 16 of these states have acted, which has paved the way for patients to have telemedicine visits easier. We're continuing to track the remaining 4 states, and we'll update our website at this site with any updates there. Another major concern in this time of social distancing is for patients who usually go to a provider's office to obtain critical infusion therapies. It's become necessary for these patients to get their treatments in the home instead. But for many, there have been impediments to getting coverage for these home-based treatments. NORD has called on Congress to pass legislation to require Medicare to provide better coverage. And finally, for most rare disease patients, it's critical to have timely access to essential and life-saving medications. The CDC has encouraged people who take medications to have extra supplies of their medications on hand. Yet some private and public health insurers have placed limits on refills. NORD joined with 95 other patient organizations in calling on congressional leaders to expand medication refill access during the COVID-19 crisis. Congress listened, and the recently enacted CARES Act allows Medicare beneficiaries to request up to a 90-day supply of prescription medications. Another major area of activity has been in the area of discrimination in access to care. We've all heard concerns about hospital systems becoming overwhelmed in light of the increasing numbers of COVID-19 patients. States and hospital systems have been trying to develop guidelines on triage decision-making in the event that critical life-saving equipment is scarce. For the rare disease community, this has been a frightening prospect and raised concerns about how these systems make decisions about which patients would receive care first. NORD has been monitoring the situation at both the federal and state levels to ensure that such guidelines do not result in illegal discrimination against those with rare diseases. NORD signed on to a letter to the Department of Health and Human Services and to the Kansas governor, and is closely watching several other states to ensure these plans are public and do not discriminate. Yet another major policy area issue is pertaining to paid leave. For so many who have fell ill or been forced to stay home to care for a loved one or prevent exposure to COVID-19, the concern has been access to paid leave. NORD joined with other patient and consumer groups to urge Congress to expand eligibility for the paid family and medical leave program to include individuals at high risk for adverse complications from COVID-19 and working members of their households. These are just a few of the issue areas that you'll see featured if you scroll through the various policy statements on the COVID-19 resources page. Next, I want to turn to the advocacy opportunities and tools that NORD has created with respect to the COVID-19 crisis. First of all, you'll see on this slide under this drop-down tab entitled Advocacy Opportunities and Tools is a COVID-19 policy issues form. The NORD policy team wants to have an open line of communication with the rare disease community. So we encourage you to click on that drop-down tab and share the concerns that you're hearing about that are impacting the rare disease community at large during this pandemic. Next, we have state-by-state resources. So for all the 50 states, we have updated the state-based page on our website to include a link to where we are going to be announcing and rolling out on a rolling basis virtual discussion groups held within each different state. Our wonderful RARE ambassadors are going to be conducting these alongside the NORD policy staff as a way to bring the community together and, again, to exchange information and to highlight issues of concern for the rare disease community. And finally, you'll see here a link that is always open, which is to join the Rare Action Network. To date, we have over 15,000 members of our list, and this is the best way to find out about, in real time, both about NORD's federal activities as well as the state-based activities that we are engaging in. So we really encourage everyone to make sure that you have signed up for the RAN list. And finally, I just want to mention some of the other resources that are available on the COVID-19 website. You will see information about both upcoming webinars that we have and how you can register, as well as on-demand content, including brief video vignettes and other video content, previous webinars. You'll find information about the various assistance programs that we have, mental health and stress relief resources, and more. With that, I will turn it back to Katie.
Great. Thank you, Rachel and Vanessa and Jill, for your presentations. Thanks for sharing very timely resources and information with our audience. So we've collected questions from participants during registration and the live webinar, and we're going to move to a Q&A session. And just as a reminder, we'll be sending the slides out to everybody who registered for this webinar. First question, Jill. We have a listener wondering if there are any diagnoses that are restricted from the COVID-19 Relief Fund.
NORD represents all 7,000 rare diseases. As such, a rare disease diagnosis is required for eligibility for assistance in this program, and all 7,000 rare diseases are eligible for assistance, provided they meet additional eligibility criteria.
Great, thank you. And just as a follow-up, Jill, wondering, is it hard to apply? Is it a rigorous application process? What's that like?
We figure life is challenging enough. We try to make the application process as easy as possible. And so literally in a phone call that can take 5, maybe 10 minutes, we can determine if you're eligible for assistance, and we can move forward from there.
Great. And now if I could ask Rachel, there's a question asking about the best way to get involved. What would you recommend as a way to become active and to support policies that are favorable for the rare community?
It's a great question, and thank you for that question. I think the best way, as I mentioned, to know about all of NORD's policy activity is to sign up for the RAN network. On our rareaction.org website, you will also find information about everything that's going on outside of the COVID crisis, having to do with both state-based activities, but also everything we're doing at the federal level. We have ambassadors in most states in the United States who are volunteer NORD members who have taken on the role of organizing all kinds of activities within the states. There are just awareness-raising activities. There are opportunities to go and visit state legislatures. So there's all kinds of ways to get involved at the state level and to stay in touch with everything that we're doing at both the federal and state level, staying on the RAN list, like I mentioned, and also following our Twitter feed. The NORD website is another great way. We have a couple of different calls to action out there now, having to do with both the paid leave as well as encouraging the remaining states that need to adjust their licensure requirements, ways to just communicate with those entities directly. And we have it all set up for you to do that. And that is where we are constantly updating the website through, again, the RAN network and on the rareaction.org page itself.
Thank you for that, and it's encouraging to see that all of this can continue to happen swiftly and in real time, whether we're in person or remote. Vanessa, a question for you about research collaborations. Our registrant is asking how we can build upon new research collaborations being established for the COVID-19 response to benefit rare disease patients moving forward.
Yeah, thanks for this important question. So from a research perspective, I think that this crisis underscores further the critical need for standardized measures that will ultimately support faster and more agile science and the ability to share and compare data collected by different researchers. There's also the opportunity to re-envision clinical trial designs that leverage technologies such as remote participation in trials, which may reduce geographic, financial, and time-related barriers for patients. So in-person clinical trials will still be needed, of course, but hybrid or virtual designs may present new opportunities for research and collaboration and ultimately greater accessibility for rare disease patients moving forward.
Terrific. Yeah, I know that's been a big topic. We're running out of time. I'll take one last question here, Jill, and maybe if you can maybe try to answer briefly. It's probably a big question, but you mentioned receiving a lot of phone calls. And so what do you perceive as the biggest problems that people are calling in with and what they most want to talk about when they contact your centers?
The briefest way to answer that, I think, is talking about access. Can we access our physicians? Can we access our medications? Can we access our treatments? And so there's a lot of concern about the logistics now to access all of these things, not only the financial barriers, but those that are created by social distancing, quarantine, stay-at-home orders. So we see a lot of challenges on those fronts, and that's a lot of what we're hearing.
Great. Well, I'm glad that your team is on the other end of the receiver to manage those calls and help out. So our time has gone by quickly. We want to thank everybody for joining us today. Our thanks again to Sanofi Genzyme, Strongbridge Biopharma, Horizon Therapeutics, and Biogen for supporting this event. Thank you again, and please enjoy the rest of your day.